Wisconsin Eye's 2014 election coverage is brought to you by the Wisconsin Hospital Association. For over 90 years, a valued voice for Wisconsin hospitals, supporting high-quality, high-value care in communities like yours.
Wisconsin Eye covering the 2014 elections. We're in Racine. We're interviewing Van Wanggaard. He's the Republican candidate in Senate District 21. Van, welcome back to Wisconsin Eye.
Thanks, Steve. Good to be here.
Programming note, Wisconsin Eye appreciates the support of the Wisconsin Hospital Association, which represents more than 139 hospitals and health systems, for making these candidate interviews possible. Van, you're in Wisconsin history books as one of a few number of senators to be recalled. Lessons learned from the crucible of 2011, 2012 in terms of political leadership, Van?
Lesson learned. Your name and your reputation are very important. You do what you say you're going to do. That's what I did. I voted my heart and did what I felt was necessary to do to bring our state forward, and I do it again because it was the right thing to do for the state of Wisconsin. So I think it's standing up and sticking to your word and doing what you said you're going to do.
You hear the Democrats say that Act 10 has hurt public schools. What do you hear in Senate District 21?
Well, I'm not sure where they're getting that information from. As I look at the things that have affected the state with Act 10, I look at about $2 billion that has been realized in savings to the different municipalities and school districts because of Act 10. With our school district here, Racine Unified School District, they actually about 6 months before Act 10 was passed, they negotiated a contract which was probably almost as conservative as what Act 10 was. I think that they realized the first year was about $13 million in savings, and by the second year was about $40 million in savings, just what they did with some of the things that they did with medical benefits and with their retirements. So as I look at it, I see that what has happened is we've allowed the different municipalities to use a tool to be able to bring a little bit more of the different benefits into line, and this was the issue. I mean, when I worked on the county board, there was a period of about 5 years that every year our cost of health care went up 25+%. And you can't continue to have your health care costs go up at 25% and not make adjustments someplace. Because there just are not limitless funds the way that some people think. So you have to bring stuff into play, and you need everybody to come to the table and participate.
Let's talk about some major items if you're elected in the next state budget. Let's start with school aids. The Speaker would like to remove the 1,000 cap on choice slots statewide. Your position?
I agree.
Why?
I believe that we need one uniform statewide voucher system. And I think that if we do that, by eliminating that, right now we've got Racine, we've got Milwaukee, and we've got the statewide program. It's very confusing for people. I don't think it's efficient. And if we have uniformity, it's going to be a lot easier for us to be able to manage it. One issue we have, Shoreland Lutheran as an example down in Kenosha, is part of the Racine voucher system. But if you're a student from Kenosha, you can't enroll into Shoreland Lutheran because it's in the Racine program. So you could go someplace else statewide, but you couldn't go there. And I think that just doesn't make any sense. So I think if we eliminate the cap, the 1,000 cap, we eliminate the cap on the number of schools that can participate, now that we have a model in place to be able to certify the schools, I believe that is going to make it a lot easier for us to be able to manage the whole process.
This summer the governor asked that Wisconsin withdraw from Common Core. Do you agree?
I do agree. I do believe that, and this is one thing that I think the governor is also right on, is that with Common Core, and I've gotten educated on it pretty well over the last few months, to me it just seems that we don't have the input on a local or state level that we should have in bringing this forward. I just don't like the idea that somebody from a federal bureaucracy is coming and telling us what to do with our schools. I think we can do a better job here. I think we have people that are capable and that we can provide our own set of standards here. Why would we want to lower our standard down potentially to a lower level for another state when we might want to be up a lot higher? And so I think the people in the districts here are going to know better, so we can do a better job on the state level to get all our stakeholders invested in it. There has to be ownership for this to work. We've done program after program has happened, but if you don't have ownership, it's not going to succeed. So we need parents, students, teachers, administrators, and the state involved. We need those 5 categories involved in the process, so everybody has a little bit of ownership, and I think we can develop our own process here.
One of the toughest issues in the next state budget is going to be transportation funding. Projections of shortfall just in the next biennium, 600 million, 700 million. How should that deficit be filled, sir?
Well, I guess, number one, it's a projection. So, I mean, when you're working with the Division of Motor Vehicles, you know, they're planning for doing transportation need changes, you know, 10 years out, and I think in some cases even a little bit longer than that because it takes that long of a process. Number one, I totally agree with the mindset and the idea that we don't raid segregated funds like our previous administration did, Governor Doyle, when he took $1.4 billion out of the transportation fund. I mean, we're still paying that back and trying to make that whole. So that's one issue. So we need to make sure that we have those funds that are dedicated to that they remain there and they're not repurposed to something else. I also think that there's other ways that we do it, and I think just about everything's on the table. My last choice would be to raise any taxes. I would rather see us do something like, as an example, I was working on a project that dealt with the Division of Motor Vehicles with registering vehicles. Right now, you register your vehicle, they issue you a state tag that shows the year, but who knows if that tag really belongs on that license plate. So a lot of people will take and use a tag off of some other vehicle plate on a plate that's not registered. And then it flies under the radar because the officers don't know unless they got a plate reader, and there aren't a lot of those around. So what it would do, my idea and my thought that we were working on was to work on a tag which is specific to that license plate. So the tag would have the individual's license plate number on the tag for it to be usable, and have to be attached to that license plate. There's probably millions and millions of dollars worth of revenue that's being lost through fraud, abuse, and just people not registering. Another area would be on the small trailers we have. I mean, I've got a small utility trailer. It's not required to be licensed because it's under 1,500 pounds. Well, those things could be licensed. I think almost every other state does that. That's another source of revenue. They actually do use the road, and so they do, you know, put some wear and tear on the road. And I don't think most individuals that own a trailer like that would, you know, have a problem with paying for it to help maintain the roads in their area. So, I mean, I think there's areas we can look at that we can make a difference with increasing the revenue.
Healthcare funding, as you know, 1 in 5 Wisconsin residents gets their health care through our Medicaid program. The American Hospital Association says our MA reimbursement rates are the second lowest in the nation. Do you think those rates should be increased? I
do. I think that this is a balancing act, though. And, you know, when I was in the Senate, almost all of our economic income that came in went towards health care. And I know that the federal government has dangled a carrot out there, and they have said, we're going to give you X amount of dollars. And that's been a lot less. Those reimbursements, those federal reimbursements are dropping. So when the federal reimbursements drop and we don't get those dollars from the federal government because they haven't, you know, stepped up and done what they said they were going to do, then it is on our taxpayers' table that they have to deal with it, and we do. So I think it's, you know, we have to decide, you know, what are we going to put into public safety, what are we going to put into schools, what are we going to put into roads, what are we going to put into Medicaid. It's a juggling act. I do agree, though, that we need to do something to bring those up so that they're reimbursed so that it's better, so it's not a loss to them, because in a lot of cases it's a loss, and that is not acceptable.
The bill to legalize medical marijuana is going to be reintroduced, and now we have the experiences in the state of Washington and Colorado legalizing recreational marijuana. You're a former police officer. Your position on those issues?
Medical marijuana, I think with the proper safeguards in place, I don't have an issue with it. I believe that that's worked in many states. As a matter of fact, I think it's CBD. The oil, the cannabis oil. We had a bill that was passed in the Senate or in the legislature here, but apparently there were some issues with that bill. We're going to look at that.
It hasn't been used.
Because it hasn't been utilized because it's got to go through a process of a study. And so it really hasn't helped the people that we want it to help, individuals that have issues with epilepsy and those types of things and seizures. I would like to see that, both of those, be authorized and be able to occur, because I think we can put enough safeguards in place. Recreational, 30 years as a law enforcement officer, I will tell you that in my view, that would not be a starter for me. I think it's a gateway drug. I know it's a gateway drug, and that would be counterproductive. And I think they're starting to find that out in Colorado, that they're having a lot of issues with it, more than what they anticipated. So I think that'll be interesting to read the next chapter, what's going on in Colorado. I would not support that here.
And it comes up every session, but your position, first offense, drunken driving, should it be a crime?
No, I do not believe it should be a crime. I, again, have 30 years law enforcement experience, 25 of those as a traffic investigator. We have one of the toughest stands on drunk driving in the 50 states here in Wisconsin. And this is kind of one of those situations that some of these states put it out there that, okay, this is going to be a crime. And then, so it starts out being tagged as a crime, but they get into court, they plea bargain it down to something that's not a crime. So they purge it off their record. So it really doesn't make, it's really not as big a thing as they project it to be. What we do here with our initial appearances in court for a first offender is, I mean, they pay a heavy fine. They are sent for alcohol assessment. They go through psychological services and to determine if it's irresponsible use or if it is an addiction issue. And whichever one it is, after they go through that process, they end up getting them into a program to help them if they have an addiction. They're also put through having to have potentially have the intoxilizer that you have to blow into on the vehicle's ignition system to make it work, or they put them out on a bracelet. I mean, there's so many ways that we can utilize that without making it a crime. And this is the other thing. If you make that a crime, then all these other criminal acts, burglaries, armed robberies, domestic violence issues, I mean, we're having difficulty with the case volume that the DAs are going through now at that level. When we do this on a civil forfeiture, the municipal courts generally deal with them, and they do an excellent job. We have a very, very low rate of recidivism here on those people that are charged. So my thing would be to deal with more alcohol education and the ability to get somebody into a program locally. I think that makes more sense.
This summer, the governor recommended drug testing those that are on public assistance, unemployment benefits, and food stamps. Your position?
I think that that's a good idea. I think that, you know, we ask people that are out there and applying for all different jobs and for all different positions to test for those types of things. And you know, when we have somebody that is on assistance, and there are some pretty good benefits with the assistance programs that are available. They were never intended to be, you know, from cradle to grave. I mean, this is something where if we can identify somebody that has some type of an addiction, potentially that's going to get them into a program to get them off of it, to get them back into the workforce where they can be a viable person, that they're really going to have some confidence in what they're doing and get away from what's strangling them.
Earlier, the governor said, let's continue to freeze tuition on the 26 UW system campuses. Now he wants to extend the tuition freeze to technical colleges. Do you support that?
Yes, I do. And again, we're going to be looking at the budget, and we're going to be looking at what those effects are. If we can do that, I think for years and years we have asked our college-bound students, and I include technical colleges, and same thing with our higher education, because that's a very important area of I think education that was overlooked for many, many years. I think the big push was towards the four-year education, and a lot of people went to the four-year education and found out, yeah, this wasn't where I really needed to be. Or maybe they got their four-year degree in something that really they couldn't find a job in. And now my understanding, about 41% of the individuals that are attending the technical college, at least down here at Gateway, already have higher education degrees, but they can't get a job, so now they're back in that field. So if we can do that to help these students that are really trying to get a good education, so they can get a good career job, I think we need to do that, because it's becoming unbearable for these young people to be able to get an education.
And then finally, do you want to highlight any differences between you and your opponent on November 4?
Well, I don't know Randy that well. I would say this, that from what I've heard and from what he's been saying out there, he's on the opposite of just about everything that I am. I supported Act 10 because it was the right thing to do. He does not support Act 10. He thinks that it would have been okay to just continue with I guess a $3.5 billion and growing budget. I don't feel that way. He's also looked at the tax situation, and I think he would probably think about raising taxes. We differ on the wage thing with minimum wage, raising it to $15 an hour. He thinks that's acceptable. I do not. I mean, those types of jobs, as an example, with the minimum wage, those are jobs that help provide an individual the ability to learn and become skilled so they can get a better job. It wasn't never designed to be a job that you were going to step into and have for the rest of your life. I mean, it was designed to help get you up in the morning, dress 5 days in a row on time for work, wearing the right clothes, learning what the process is to get to the next step and what you're doing. I started out flipping hamburgers at Carol's Drive-In here in Racine. Mel Vito was my manager, just an awesome little guy. I remember I got my first check. It was $1.15 an hour we were getting paid. And in that process, when I got my check, it was less than $40. And I said, who's this FICA guy? And that was my first realization that I'm going to be paying taxes in for what I'm doing. So it really made me think about the money I was making, and I earned that money, 40 hours, being there and being on time and doing what I needed to do, being dressed and learning the product. And it was but a few months, and I got an increase in pay because I did that. So I think that incentive, that learning process, that's something that stuck with me my whole life. And I think that that's important for our young people to understand that if we bump this to $15 an hour, that's going to close the gap on other positions. So that means that every one of those other positions are going to have an increase. And who's going to end up paying that? The consumer, because it's going to be transferred back to somebody. So I think we need to be a lot smarter with how we approach this and what we're doing, and we need to stop pushing people to staying in a minimum wage job and help show them how to become interested in getting those basic skills needed to get them to the next step, and then help them get the education to be there. That's what I would focus on.
Thank you. Van Wanggaard of Racine is a Republican candidate in Senate District 21. Van, thanks for talking to Wisconsin Eye.
Thank you, Steve.
Thank you.